Hello, I'm Dr. Richard Swift. I'm a board-certified plastic surgeon in Manhattan, and I would like to talk about 5 things you need to know about recovery following breast augmentation. So I'd like to start off by saying it's much easier than you think it would be, and it's much less painful than you think it would be. And this is because of the newer techniques that have evolved. And I use something called the dry pocket technique. And by doing that, I make incisions to make these breast pockets, but I use a device, a cautery, and I control the bleeding as I'm doing this dissection to create the pocket, and in order to stick an implant like this in. And by doing this, there's less fluid, less bleeding. That translates into less pain and easier recovery post-operative. By doing a blunt dissection, where things are sort of torn quickly, there's much more bruising and much more bleeding and much more pain. So we're not going to do that. Okay? So another thing too I'd like to say is that if you have a desk job, most of these women can return to work within 1 week. And they're able to do, day-to-day things like that without a problem. After a day or two, there's no reason why they're not on their computer, answering a phone call, talking with their friends, watching TV, etc. But there are some limitations. So let's talk about that. The first one is walking. And it's good to walk because we're not really designed to be immobile. And the idea that you're going to go home, lie in bed, get under your comforter, people are going to take care of you, that's antiquated. You should be up. You should be able to go to the kitchen, the bathroom, whatever, yourself, and that's good. Also, importantly, it minimizes the chance of developing a blood clot in your legs. So early mobilization is a very, very important requirement. Number 2, surgical bra. All the patients wake up and they have a surgical bra on, and usually it's a front clip closure, and it gives some compression, but there's no underwire in the bra, and it's not any kind of like push-up bra. It's a bra that gives support and compression. But what happens is when we do the breast augmentation, we release the pectoralis muscle, we do something called the dual plane technique, so it's partially behind this pec muscle up here, but you want this implant to drop down. And if you have too much support, too much compression, how will it ever go into the lower pole or the lower part of the breast and develop that nice curve? So it's a bra that gives some support, but it's a soft compression bra. Okay, let's talk about the next thing, range of motion. This is really important. And think about this. We take a long flight somewhere and we notice that we're a little stiff, a little uncomfortable. And that's because we have the muscles have been immobilized, we're not using them. So we're going to start early range of motion. By the next morning, you should be able to touch the top of your head 5 times. And just fixing your hair counts as one of those times. But that will help the muscle recover and you'll have much less discomfort if you do that. And this range of motion, and part of that is that the pec muscle is attached to our humerus, our arm, so every time we're moving this, we're beginning to massage that, and that's a good thing. The next thing let's talk about is exercise. And this is a very important thing, and no matter who does this operation, they're all going to want you to limit the exercise for the first 4 weeks. And that is because you don't want to stir up bleeding, which can later lead to problems like hardening of the breasts. So for the first 4 weeks, you don't want to cause any trauma there. And when we exercise, for instance, say we're on an exercise bike, we might notice after a while our cheeks are turning a little bit pink, the veins in our hands are dilating. Why? Because exercise is a systemic response. Although the legs are doing the exercise, the whole body gets involved in this. And you don't want to amplify the inflammatory response and cause more swelling and possibly bleeding, which is very bad. So for the first 4 weeks, you want to take it easy. Walk around is great. At 6 weeks, you should be able to do weights and do a push-up without a problem. But before that, you really want to limit that during your early recovery for long-term peace of mind and happiness. Okay, let's lead us to the fifth key point, and that is massaging your breasts. You don't have to manually massage your breasts. And part of that is the pocket's created. It's just enough just so this implant's in there and has some motion, but not a lot. But think about this. The implant is below the pectoralis muscle, and every time you're moving your arm, you're essentially massaging your breasts. So there's no need for you to have to manually, externally massage your breasts. So that's a relief. And just as a bonus, I'll throw something else out there. There's no need for drains for this breast augmentation because of the dry pocket. And that should be reassuring too. Well, we've gone over a number of things today. If you have any questions, feel free to reach out and inquire, and I'll be happy to help you. Thank you.